Please welcome Elliot Parker talking about the benefits of clinical 3D printing.
I founded Additive Care in 2017 out of frustration with how slowly hospitals were adopting 3D printing as a clinical solution. And so today, or since then, I've really become an evangelist for 3D printing. And today, I really want to impress upon you, what is the future of surgery? What's going to be happening? And the way I see it is that any patient going into surgery in the future is going to have a surgical replica made that the doctor is going to rehearse that surgery on. There's going to be a surgical guide made for that surgery. There is going to be a metal implant that's going to be custom made for that patient. And even the instruments the doctor is using is going to be a 3D printed device. So some quick context as we roll into this. What is 3D printing? Who here has done any 3D printing in the past? Great. 3D printing is very simple. It's really just a layering process. A computer mechanically deposits layers of material, and those layers are then fused together with lasers, glue, or heat. The ingredients of 3D printing, for anyone to get started with this technology, you need a 3D printer, you need to develop some level of expertise on that machine, and then finally, you need a file source. And for hospitals, MRI machines make a fantastic file source. You can also use a CAD scanner or a CAD designer. So what are hospitals 3D printing? Patient-specific surgical replicas. These are generated directly from the patient's MRI and CT scans. They represent they demonstrate a specific condition that the patient has. How is this being done? A patient goes to a hospital, receives a scan. That scan is manufactured on some set of 3D printers somewhere. We send that part back to the hospital in what's called the preoperative planning window that will allow the surgeon to plan the surgery before for the patient. How big is this problem? Well, there are 140,000 surgeries of these types of surgeries every day. Highlighted there in blue are some of the more complicated and therefore some of the longer lasting surgeries that would benefit the most from having a 3D print made. And now I want to dive directly into the benefits. The benefits are going to be categorized by who they help, how they help, and where they help. So I like to say that 3D printing is a win-win-win scenario. The patient wins, the doctor wins, and the hospital wins. Some of the clearest clinical benefits of 3D printing is that it improves surgical outcomes. This has the potential to be a life-saving technology because 3D printing severely reduces the number of complications and the severity of those complications, as well as the amount of blood loss. There are indirect patient health benefits. These are going to be emotional benefits that the patient experiences because of 3D printing, or direct patient health benefits, smaller incision size, smaller wounds. 3D printing really helps to enable minimally invasive surgeries. Some of the indirect benefits are the emotional benefits. These are going to be increased levels of comprehension. Patients are going to feel more comfortable going into the actual procedure, to be more satisfied when that procedure is over. There are also major overall cost-saving benefits for each patient. The physician doesn't miss out either. There are direct benefits where improving the physician ultimately improves the health of the actual patient. The physician is going to rehearse this procedure in a risk-free environment. There are also indirect physician benefits where the physician is going to feel more confident going into that procedure and is therefore that is going to reflect in the patient outcomes. It also really helps to alleviate ambiguity going into that surgery. The physician really is going to want to know, or is going to know what's going on. Great resident education tools. For residents, they're going to be exposed to various scenarios or cases they may not have otherwise seen. And then the hospital benefits. Hospitals are going to be able to optimize their resources. So with 3D printing, you can do more planning with how you're sectioning out your staff, how you're sectioning out those staff resources, and then happier patients improve hospital rankings. Now, having said all of that, if you were going into surgery, raise your hand if you want to be at a hospital with a 3D printer. A lot more of you, great. And finally, in closing, I really want to impress upon you just a few ideas. Today, we covered a lot of the clinical benefits. When you visit your doctor, ask your doctor if 3D printing is right for you. I also want to leave you with one last thing. Everyone thinks 3D printing is a relatively new technology. The first patent for 3D printing actually happened in 1980. 3D printing also has a very long history of being co-entwined with healthcare. In 2002, hospitals in the UK were able to plan a conjoined twin separation using a 3D printed replica. And I couldn't do any of this without my team, so I'd like to say thank you to Joy, Ishan, Eyal, Sam, Ernest, Wilson, and the Silicon Valley Software Group. Thank you very much.